Again. Well, I'm quite pleased actually, because hopefully I'm going to expand a little bit more on John's question earlier. So I promise I didn't actually set him up to ask that question. But the original title of my talk was Treatment Management, and I thought about it quite a lot and thought, hang on a minute, that's not really what we're about. And you know, there's a whole other side of our, you know, management of patients out there than just the treatment. So I've changed it to self-management, which hopefully you'll agree is much more appropriate. So treatment management versus self-management. In my head, when we talk about treatment, we're talking about treating the body mainly as well. So initially I was going to talk about how best to help you manage your medications, you know, how to manage, you know, having a blood transfusion. And I just thought to myself, but this is just one small part of the condition here. And actually there's a lot more that as a nurse we do to help you day-to-day manage your conditions. Self-management is a different concept, and it means that we're looking at the patient as a person as opposed to just a body that's being treated. So it's personalised care. It's coordinated amongst many different teams. Again, we're sort of bringing in all the different teams and areas. And we're enabling the patient to take some responsibility and some control of their own condition. And that's my perception of self-management. Another way of putting it, and as I was doing some reading on self-management, and that is one paper that I was reading says that the culture is changing from people asking, well, what is the matter with you, to what matters to you? And I think that sums it up quite nicely, and I think that's quite important. So definitions of self-management, I've got a couple here. This one's quite basic. They're both cancer related. There's a lot of self-management out there, and actually self-management originated in chronic long-term diseases. And it's kind of been adopted by the cancer community as well, as over time cancer's become a lot of long-term chronic diseases. So, and I've just highlighted the key words here really. So approaches that people can use to optimise living with their conditions. Macmillan, who's a UK-based cancer charity, have expanded on this and given it a slightly different twist. And they've kind of talked about it as an awareness and participation. And they talk about this as if someone's had some treatment and have come out the other side. And Macmillan are very much about survivorship with cancer and surviving your treatment and after your treatment. I think if we took out the to minimise the recovery, recuperation and rehab part of this, we can still apply it to MPNs. The main difference is obviously you haven't had a treatment and you're recovering from it. This is an ongoing continuum for you. But I think, again, it gives you a good idea of what self-management's about. So this is a bit wordy, and I do apologise, but I wanted to put it all in, really. So basically, there was so the systematic reviews, a company looked at the evidence from systematic reviews and summarised what they felt that self-management was about, really. So it's about you playing an active role in managing your own condition. And unfortunately, sometimes that means making some difficult lifestyle changes, okay? But in order for you to do this, you've got to have the knowledge and the skills, the confidence to do this, okay? You can't just go out there and off you go, okay? And also, we've got to think about the practical and emotional impact that this is going to have on your lives, but also how giving you this knowledge and confidence, how that will hopefully improve it. Okay. And then the last sentence, really, they've discovered from looking at all these papers that actually there does appear to be a benefit. People do feel like they have an improved outcome. So I think that's really important. So there are a whole host of self-management programs out there. In the UK, we have one called the Expert Patient Programme. Macmillan also have done one based on the Expert Patient Programme called Living with Cancer course. One of the original ones was from the breast cancer patients called Taking Charge. But if you do a quick Google for self-management programs, there's private companies that also do them. But in general, you're looking at a 6-week course. Looking at quite a lot of different programs, I kind of picked out that there's pretty much general themes in all of this. And a lot of it is very much about chronic health, goal setting and making a plan, choosing a goal, how to choose that goal, making it smart, and how to try and carry through and achieve that goal. They do focus a lot on things like relaxation, exercise, nutrition. Some of them do mindfulness, okay? And also there's quite a focus on handling your emotions, okay? How to communicate, how to go into a consult and communicate, but also how to manage and communicate with your family and friends. Tell them that you've got a cancer or that today's not a good day. How you're going to communicate to people, managing in your day-to-day life, really. Okay. And also about how to manage your symptoms. That's very non-specific, really. How many of you are thinking, oh, maybe we should do this for MPNs? Interesting, isn't it? So, bringing it back into a clinical setting, a hospital setting, obviously we can't run a self-management course like that, but we can still promote and encourage the patient to achieve a certain degree of self-management. There seem to be 4 general areas in which her nurses are able to help do this, and so I've taken all these headings and gone through them briefly for you. And I did read another paper that said that we tend to do this in different ways. Sometimes we act as a gatekeeper, sometimes we act as an educator, sometimes we act as an enabler. I can't remember the last one. And I think it just depends on the situation and who the patient is, depends on our approach. So, expectations. If you know what's going to happen, it's a lot less stressful. It might not make it any more pleasant, but at least you're not going in there terrified, anxious, and everything else, okay? So it's kind of down to us just to try and help you understand and know what's going to happen. And a very simple and obvious explanation example is having a bone marrow biopsy. You go into that room, and if you've got no idea what's going to happen, that's a bit of a shock. But if we can sit you down, inform you, give you some information, let you know potentially how you're going to feel afterwards and what the outcome's going to be, then actually it makes it just a little bit more bearable, okay? I've put MPN at the top. I mean, that's an entire topic on itself, but as you know, some people do like to know their prognostic scoring. Some people like to know what the natural path of the disease is. Some people like to know that actually they can expect to carry on and live a normal long-term life. So that's, that one's a little bit grey, but it's still about the expectations. And it's about managing the expectations as well, really. What else shall I pick up on? Managing the expectations about treatments, and that's very much about educating you and giving you the knowledge to make your decision about your treatments. We try and offer people an option of treatment if possible. Usually it's between pegylated interferon and hydroxycarbamide, and that's very much about this is what it is. This is potentially how it's going to make you feel. How is this going to fit with your life? A really good example of this is the pegylated interferons. One of the most frequent symptoms is that it can give you this, I'm laughing, it can give you this flu-like sort of symptoms within a few hours of taking it. I'm laughing because one of my patients likened it to feeling like having a bit of a hangover, which I don't know, we'll see. But if you can let them know that this is potentially how they're going to feel and that it will pass and that it is okay, they're less likely to worry about it and panic about it, and it will be oh yeah, Yvonne said this was going to happen. Okay, that's fine. She told me this. She's told me to take some paracetamol and drink some water, and I've got her number, so if I'm worried, I will ring her. 9 times out of 10, when I ring people up the day after they've taken it, hi, how are you? Any problems? Because we always ring them after their first dose. They'll say, oh, no, I had that, and, like you told me, but it's all okay. The flip side of that is I also have to tell people that it's okay if you don't get those symptoms. It doesn't mean that you injected it wrong, and it doesn't mean that your body's not absorbing it, because I've had a few people worrying, going, well, I felt absolutely fine. Do you think I did it right? Should I give myself another one? And I'm like, no, absolutely not. That is also okay. It's fine. It's great. Crack on. What have I got? 10 minutes. Okay. Obviously, expectations about trials. I mean, we talked quite a lot about trials yesterday, but it is very much about also trials can be very intensive. There is a lot of toing and froing. There is a lot of blood tests. Some of them, there's a lot more bone marrow biopsies and scans and everything else. So people have to know and have to understand that, that's what they're signing up to. And it is an agreement really as well. Obviously, we have these lengthy consent forms, but actually it's nice to sit down and actually go through it with them and say, look, this is what you will be expected to do, and this is how it's going to be for you. Okay. Venesections. It's my baby venesections. Obviously, the first venesection can be a bit of a shock. People can have a vasovagal, so it's very much about saying to them, preparing them for a start, but also saying to them, it is quite a big needle, you might feel a bit lightheaded, make sure you've eaten well and everything else, so that they're aware of exactly what's going to happen. Don't be jumping up straight after the venesection and running for the bus, because you will end up on the floor. So when I used to work at St Thomas's, we used to be right next door to Westminster Bridge, and the men from the city would come in and have their venesections, and they wouldn't listen, and they'd never wait, and I'd give them my sternest sister look, but it didn't matter. I can do it, can't I, John? And yes, you have seen it, yes. And they'd still get up, and you'd get a call a bit later, they'd fainted on Westminster Bridge. It's like, so very much about trying to say, no, you have to say, this is why, this is what's happening. Okay, we've just discussed this quite a lot. What can patients do to help themselves, and how can we help you to help yourself? We've already covered yoga, we've covered a little bit about exercise, and we've also talked about the herbs. So I found this online, this natural herby thing here, for $130. Not sure what's in it. Didn't look any further, but I was pretty horrified, to be honest, that that's kind of cashing in on a condition. So just be very careful. It might be very good, but you could probably go down your high street and buy supplements just as good without having to pay a fortune. Do try and run supplements past us. As previously mentioned, some of them like the curcumin. Interestingly, that's one of the most common ones we get asked about as well. There are situations where we might be a bit cautious, and quite often it would be in situations where people are on certain blood thinners, because curcumin can actually sometimes increase the risk of bleeding. So we don't always say no, but sometimes we'd just be like, oh, not sure, we might need to be a bit more careful with that. What dose are you planning on taking? Okay. Cannabis oil is another one. It's coming up more and more. Now, so there are two bits to cannabis, okay? So in the UK, cannabis oil is licensed for epilepsy, and it's licensed for people having severe nausea and vomiting post-chemotherapy when they've failed other drugs. But the form of cannabis that is used is just the CBT stuff. There's something else called THC, and that's the chemical that makes you high. And they take that out of it to use it as a drug. If you are buying cannabis from wherever you are getting it from, you can still buy the two forms. If you buy the one with THC, it's ultra illegal and it's going to make you high. But there are apparently, I've been told, places out there where you can just buy the non-high version, which is almost like the medical version, but it's unfortunately still illegal. We also have cases where people are telling us that they're trying to come off treatment and they're taking CBD. Now, obviously, we can't advocate it in any way, shape or form, but we appreciate the honesty and we need to know so that we can keep a closer monitoring. And we've got one young lady who stopped her treatment. We can't force her to start again. She's on cannabis. What we're doing is we're working with her, bringing her in a lot more often to try and monitor her and just see what's happening to make sure that her platelet count doesn't rise too high while she's doing this. Obviously, we're going to ask you to try and cut down on your alcohol, stop smoking, the usual health education activities that we try and do for you. And I think that's where the difficult decisions come in, not when people want to stop smoking, but unfortunately it does help to optimise your health. And these are quite often all things that you can actually be doing for yourself, monitoring and recording your own symptoms, so that when you come into the consult, going back to the previous one about communicating, you can say to us, this is what my symptoms are, this is how I've been feeling over a certain amount of time, as opposed to getting in that consult and it all just going out of your head and forgetting. You know, you have limited time in that consult. When to seek medical help, this is really important. We're not saying to you, off you go and self-manage, don't need to see you again for ages. But quite often we do give people quite a long leash and we might not see them for 4 to 6 months. So, you know, we do need to make sure that they know what to do and when to seek help, okay? We use a traffic light system here, red, yellow, green. In general, I tend to explain to people a red traffic light is immediately life-threatening, and, you know, you would be dialing here 999, 911, whatever your emergency number is. You would not be wasting time ringing me. You would need an ambulance there and then, okay? On the opposite side, a green light, and I tend to say to patients, I'm not sitting at my phone at my desk waiting for you to call. I might not get back to call you for a day, or if you email me and it's not urgent, it might take me another day. And stop and think, can this wait for 24 hours before Yvonne gets back to me? So it might be, I've just got a little bit of a rash, I feel okay, should I go to the GP? Or I've had a cold for the last 24 hours, is it okay if I take ... If you can think, yeah, it can wait, I need some travel insurance. Can I travel with my interferon? All that kind of stuff. That's a green, and you can email me or you can ring, leave me a message, and I will get back to you. The yellow is that bit in the middle. Don't know. Is this an emergency? Isn't it? You wake up at 3 o'clock in the morning with a nosebleed and you can't stop it. Should I go to A&E or should I just stop for a bit longer and see what I can do? I don't know. Then you can ring. We have a 24-hour cancer hotline. It's manned by our acute oncology nurses in our brand new cancer centre, and therefore people can ring 24 hours with their concerns or their worries. Another very important one, and the reason actually the number was designed is it's quite rare for MPNs, but you are on chemotherapy, some of you, and obviously there is a risk that the white counts will go low, and therefore we do say, you know, if your temperature goes up 37.5, you suddenly feel unwell, then you would want to be ringing that yellow number and just going talking it past them. Other reasons that we have people ring in acute oncology is, let me think, I've got a sudden thumping headache and I cannot get rid of it. Now to us, that might well be a red flag, okay, because you just want to make sure that someone hasn't had a sudden bleed in the brain, a clot. So we would say to them, absolutely, you should be ringing acute oncology for that, and they will be directing you the right way to go. Any sudden acute abdominal pain that you just can't get rid of as well. Okay. It is a little bit difficult to pick out exactly what to be ringing who for. So in general, I say, if in doubt, ring acute oncology and they will direct you the best way to go. Try and direct people where to find out more. We call it signposting. Obviously, we've got a hefty range. We're very lucky of the MPN Voice information booklets that are disease-specific and treatment-specific. And we also have the charity, the organisation also have their newsletters, and they have the online chat group as well, Health Unlocked, which is where patients all interact and ask their questions as well. And some of us spy on it from a distance. I found this cup the other day. That made me laugh. So, trying to direct people and signpost them to information that is correct and valid, okay? Things like giving up smoking, cholesterol, we tend to use in the UK, the British Heart Foundation. They've got some brilliant booklets. So I usually direct them there just to help if they want to talk about their blood pressure or they're looking at trying to reduce the cholesterol in their diet, okay? And then, what else? There's a very good alcohol website as well, Alcohol Concern, and they, so I'll direct them to them for information about reducing their alcohol. We also have in-house smoking cessation and alcohol reduction referrals, and we've got a team in the hospital, so we can refer people to them if they want help to try and make these lifestyle adjustments. We're very lucky. Okay. And then general health education, I quite often get asked questions about things that have got absolutely nothing to do with haematology. I'll do the best I can. I'll sit and look with them on the internet. Not quite a Dr. Google, because I tend to use the NHS websites, or quite often the Mayo website's a very good source of information. And so I'll sit with them and direct them to certain websites that actually look like they are proper organisational-led sites, rather than just someone sitting in their room. Okay. So just to summarise, really, as I've said before, the benefits to the patient and also to the carer, who I haven't talked about much here, but they are there, okay, is that if we can just enhance your self-management, enhance your ability just to be able to take some control of your condition and manage yourself a bit better, and you know what to do, when to do, then hopefully you'd enjoy a slightly better quality of life. Now, obviously, this has come from the courses that are running these self-management courses, but I think it can also be applied, if we can get this a bit better, hopefully you would agree, to generalised self-management as well. There's also a benefit for the healthcare professionals, and it means that actually if you've got your communication skills, you know what you're doing, actually our consults can be a lot more meaningful. Quite often that will work by the nurses taking the patient away and talking to them in a language that they understand as well, just to try and help increase their knowledge of the condition. So next time they go to that consult, they've got a better knowledge of what's going on, what they're doing, what they've been asked to take, what they're choosing between. Okay, and it means that we can deliver our services in a slightly more joined up way as well. Thank you.
Thank you very much, Yvonne. If someone has some question, please. Peter.
Yeah, hi, good morning. Thank you very much for your speech. Whenever I hear you, I just consider how happy the UK patients are having a system as you have. Neither in Switzerland nor in Spain, in many other European countries, we just cannot even dream out of this. You know, that you can call somebody when, your nose is bleeding or whatever it is. Just forget about it. You have to go to the hospital, and you have to go to emergency. There's no other solution. And if you're very good with your doctor, you have his private mobile phone, and you can call him, but then you have to be a very close friend. So I would say, congratulations for what you have been building up. It's a fantastic service. And, we will have to think over what can we do in order to get that service in other countries too.
Thank you. Yes, we are very lucky, and I'm always a little bit wary about coming and talking to people from other countries when I'm aware that we've got this singing, dancing service and it's not actually available. But what I'm hoping to do is just to give you ideas of what potentially could happen. But also, this self-management program is something that you don't need to have a specialist nurse to do. It's something that potentially could be thought about by the advocates group, and whether it's something you could, in your countries, think about rolling out. Yeah, absolutely. If you don't have the services, you're going to have to go to A&E. That's the way it is. But if you do go to A&E, wouldn't it be helpful if you were able to manage that a bit better, and know what you're saying, and know what your bloods mean, and know exactly what you need to do, rather than sit there and in a waiting room for hours. So it's about that as well, really, and I think that's a huge potential.
At least you can go to the hospitals where they have your history. For example, if I always go to the same hospital, so they know exactly who I am, what is my history, etc. So I don't have to explain, from my childhood, all the things which have happened to me, etc., etc. So this is already a big advantage. But effectively, self-management, these things, we could promote it through our local patient support group. and we will definitely think about it and see what we can do. There's no
Certainly,
question.
there's plenty of resources out there. I mean, I started my sort of research for this talk by just doing a Dr. Google of self-management, and then I brought in sort of medical, and then the role of the nurse, and then chronic conditions, and started looking on the slightly more academic side. So just a very basic, you know, we'll bring it up and show you what it is and how it works. So yeah.
Someone else?
Thank you.
No.